I hate to really get into conspiracy theories. I generally try not to indulge in them. But the truth of it is that having been out there and dealing with various people out in the medical marketplace and therapeutic marketplace, and seeing the sway and the power and the influence of the pharmaceutical industry, and also the influence it wields within the FDA itself, and also the quality of the research done for drugs that have been passed by the FDA, I see there's a double standard being applied in regards to CES. Yes?
About half my lifetime ago, I was ordering stuff like this, and there was no problem. When did the axe fall?
Okay. The axe really hasn't. The question is about the axe having fallen. The question is about being able to order all this stuff. You'll find a lot of CES units and variations of CES available through New Age catalogs and the like, or New Age journals, various and sundry publications. There's lots of CES equipment being manufactured in garages and cellars all over the country. CES of varying degrees of quality, varying degrees of expertise having gone into those units. The FDA, for the most part, has not really had the axe fall on them. We chose to go a very different route. We chose to go the legitimate route. We chose not to be an underground unit. We chose to market this openly. We registered directly with the FDA, and as such, we now are under their surveillance. It is simply because we decided to bite the bullet on this. We wanted to go legitimate with it. We wanted to be introduced into the therapeutic and medical community. We want to gain acceptance for it, and we believe that we have the research and will have additional research to justify and prove its safety and efficaciousness.
Who can write script for this type of unit?
Okay. Generally, it requires an MD to write the script. However, again, the law is really quite vague in regards to CES. It's quite vague in the sense that it speaks of a licensed practitioner. It means, what is the scope of your license? Does the scope of your license embrace the utilization and deployment of modalities such as CES? You know, that's pretty vague. Now, what that means is, yes, an MD, no question. Can a psychologist employ this? Probably not. But, well, psychologists seem to know something about anxiety, depression, and insomnia. But no, well, they're not really MDs. Real questionable. Now, who's going to challenge this? It wouldn't be the FDA, it would be the AMA who would challenge that if they were really interested in electromedicine at all. On the other hand, chiropractors in Washington State are not allowed to utilize anything but their hands. They can't utilize any form of electrical stimulation. In California, Arizona, New Mexico, Florida, et cetera, they can use TENS units and electrical stimulation. So chiropractors can use CES in those states and could write script for it. Now, that seems sort of crazy. Now, what do chiropractors know about anxiety, depression, insomnia? Do they know a bit more than psychologists? It's a very fuzzy area, a very gray area. Nobody has really challenged that directly. The day will come when CES, hopefully, will be available across the counter. Yes?
How similar is CES and TENS?
TENS involves electrical stimulation, but never, ever should be utilized above the shoulder. We're talking about a much more powerful unit. CES should only be used, can be used both for areas of physical pain as well as for cranial stimulation. TENS should never be used on the head, never. You really could cause very severe damage. There are people who play, one of the problems is people play around pretty extensively with electrical stimulation. You can induce a variety of states, but you can also bring about considerable damage as well. There are other frequencies besides the particular configuration that exists in our unit. Most of the research that is, that is available right now is based on the particular configuration that exists in our CES unit. This is not to say there aren't other frequencies, other waveforms, other duty cycles, and other mixes and matches that don't make sense and couldn't produce extraordinary results and extraordinary states of consciousness and engage in particular modes of healing, but we don't know enough about them. We don't have the research yet on those. Meg Patterson, whose black box was utilized by Keith Richards and by Pete Townsend and by Eric Clapton in terms of getting them off the heroin habit, Meg Patterson utilizes different frequencies, different waveforms, different duty cycles, and different amplitudes depending upon which addiction she is treating. We found, however, that the 100 hertz and the particular configuration that exists in our unit is equally as effective in treatment of a variety of forms of addiction, and we've done this nationwide. Yeah.
Are you aware of any properly documented evidence of any frequency-specific effects?
No. Understand this, the FDA their blood would bubble at the notion of approval. I mean, basically, they don't approve. Their thing is they don't approve of anything, and you never should ever say that. I mean, that's dirty stuff.
There's only one frequency that
No,
they're licensing.
no. Actually, they're not really licensing either. See, let's try to just sort of get the law straight on this. It's really difficult to understand because the FDA itself doesn't understand its own laws. I mean, basically, the gist of our correspondence back and forth to the FDA is you don't understand your own rules and regulations. Here's what they are about. And they still don't comprehend. Essentially, again, in 1976, this medical device amendments was passed. This act was passed. It gave the FDA authority over medical devices. It enabled them to assert that particular forms of medical devices were misbranded or adulterated, that they were neither safe nor efficacious, nor was there sufficient proof along those lines. There were also a group of devices that were exempted from control of the FDA. Those are devices that were pre-76. They were grandfathered in. Any devices then afterwards that were shown to be substantially equivalent to what existed prior to 1976 were allowed to be marketed and also are allowed to carry those same claims until such time as the FDA issues a pre-market approval call-up and a panel is convened to really judge for safety and efficacy. Our unit has been deemed by the FDA to be substantially equivalent to what existed prior to 1976, and therefore we have every right to market and make those pre-76 claims. They argue, no, that we're misbranded or we're adulterated, and we're saying to them, the law says you have no authority whatsoever over pre-1976 items. You have only one recourse, which is to issue a pre-market approval call up your experts, your authorities, your panel of neurologists and whatever, and we will present our evidence, and we believe then that we will be able to move up to classification 2. The FDA is not going to do this, however, for a couple of reasons, because it has to go to Congress to ask for the money for the PMA call-up. And when they go to Congress, Congress will say, well, what's the rush? They'll say, well, it's important. They'll say, why is it so important? Is there a safety issue here? Well, we've got an exemplary safety record. There's probably 25 to 50,000 CES units out in the United States right now. There's not been one recorded instance of death or problems from utilization deployment of CES. Somehow, though, we've gotten lumped with breast implants and penile implants that are exploding all over the place, and this little 9-volt battery unit has been just damned with guilt by association. Now, that's sort of a scenic detour around your question. There are other configurations that are also grandfathered in. This 100 hertz configuration that exists in this unit is one of them. There's another configuration that's in the list stimulator or the pain suppressor, which is another configuration that was pre-76 as well. But those are the only two pre-76 configurations that are presently on the market. People are playing with other frequencies, though, among them Meg Patterson and a few others.
But those two frequencies are pre-1976
Right.
for either 100 cycles or what? 80?
There's a 15 hertz and 15 kilohertz alternating burst approach. Yeah.
Since this technology has been used for, what are the results, say, with people with brain damage, neurological disorders?
We have one of the most interesting aspects of this has to do with enhanced cognitive functioning. And again, we have to watch ourselves on this, because if we go outside of our claim area of the grandfathered claims of depression, anxiety, insomnia, they will come down on us like a ton of bricks. So we stick very closely to those claims: anxiety, depression, insomnia, stress, and the stress-related disorders. But it's extremely clear that if you do something about stress and stress-related disorders, anxiety specifically, things are going to happen in terms of cognitive functioning. And so we've been working with people with closed head injury, for example, with extraordinary results. And we've got a small study that was done at a setting in Texas involving closed head injured patients. And it showed significant results, not only in terms of indices of depression being reduced by 50%, but also enhanced cognitive functioning and also reduction of frequency and severity of seizures in the area of closed head injury. We've also shown incredible results in a recent study involving ADD, attention deficit disorder, not only involving the kids but their families as well, 27 subjects, employing not only our unit but some of the other CES units as well. And again, stress and disease reduced by about 50%, I'm sorry, and IQ scores going up by about 15 points. And we've checked back a year later, and the results have held. Yeah.
Find out why the 100 hertz really works?
Everybody always asks, why the 100 hertz? Why the 100 hertz? I don't know, okay? It seems that the 100 hertz was the first configuration that was applied in Russia, the former Soviet Union. It's a configuration that has been explored most thoroughly here in the United States. There have been other units out there, like the brain tuner, for example, the primary underground unit of Bob Beck's. It is not a 100 hertz unit. I think it's about 111. It's a different kind of waveform, different duty cycle as well. There's also the alpha stim, which employs a 0.5 as well as 80 hertz, and now I guess they've gone to 100. So people have been playing around with other frequencies. But again, the entire body of research, 90% of the body of research, rests on that 100 hertz, 20% duty cycle, sinusoidal waveform, 1.5 milliamps at max in terms of the amount of current flow, the extent of the current flow. Why? I don't know. We've been working extremely closely with a couple of scientists from the Pavlov Institute in Russia, Professor Valery Lebedev and Dr. Yakov Katz-Nelson. And they were here last year, and they've got their own CES unit that they've developed in Russia. Russia does not have the pharmaceutical industry, clearly, that we have here, and it does not wield the kind of influence that it wields here in the United States. And they've had to develop a variety of alternative approaches. Their CES unit is just extraordinary, what they have going there, and they're working primarily with a 77 hertz unit, but involving both direct current and alternating current. He's now modifying it. He's going to be coming back here in December, and we're going to be jointly filing a patent for a new device that he's developed. But they've worked with, in the field of electroanesthesiology. They've worked in the area of tissue and wound healing, treatment of duodenal and gastric ulcers, myocardial infarction, as well as pain and treatment of alcoholism employing CES. But their primary focus has been the endorphinergic system. And we've been involved, and we believe the 100 hertz works in terms of bringing a variety of neurotransmitters back into pre-stress homeostasis, including most of the catecholamines, the dopamine, the serotonin, the norepinephrine, as well as the endorphins. The major focus of the work of the Russians has been on the endorphinergic responses. And we're very, very excited about their work and what they have. And we see them as being something we're really working towards in the future. Right now, we know we've got a 100 hertz unit that works. We know that it works as well as any of the damn drugs that are out on the market right now with none of the negative side effects. I would recommend a book to all of you. It's sort of become my Bible. It's a book called Toxic Psychiatry by a fellow named Bregan, which deals with the extent to which the medical industry and the psychiatric establishment has become essentially nothing more than drug pushers. And one of the issues that we've dealt with in terms of patients nationwide utilizing the CES has been not just dealing with the cocaine, the heroin, the methadone problem, but with the prescription drugs. We have a prescription drug epidemic in this country. We've been getting people off the Prozac, off the Xanax, off the Halcyon. And of course, you probably know by now, former President Bush and both Bush and Secretary of State Baker were on Halcyon for an extended period of time, taking you for jet lag. And it makes for a fascinating story in itself. Maybe sometime we can talk about that. Because you saw what happened to President Bush, and you know what his syntax is like. Yeah.
There was recently an article in the Seattle paper about the potential dangers of electric shavers relating to cancer. And I'm wondering just how this device relates to, like, Dr. Robert Becker's work with EM fields.
Yeah. There's a lot of fears around electromedicine. There's a lot of fears about power lines, about colored TVs, about electric blankets. I guess my dinner with Andre and that whole thing about electric blankets at the end of the film, if those of you remember it. But I don't know. All I know is that I think there are some legitimate fears there. I think Becker is correct. I think Becker has moved sort of from one position to another. He became the major advocate for electromedicine, and now, because people sort of went in there blindly and just began to indiscriminately utilize it, he became very fearful of what he had opened up. And now he's waving all kinds of signals, beware. There really is a basis for some of his fears. I think the power lines are serious dangers. I'm sure the microwaves, the color TV, et cetera, we're surrounded by a variety of electromagnetic fields that are impacting on us in a negative fashion. It's my sense, though, based on the research that we have, that this 100 hertz in this particular configuration we're working with is safe.